Hi, my name is Cameron. I'm a student physical therapist, and today we're going to go over some ankle tests. Are you permission to start? Perfect. First exam we're going to go through is the passive range of motion with overpressures of the ankle. So we're going to have the patient in prone, bring the knee into 90. We're going to brace at the calcaneus, and the other hand is going to be the sole of the foot. We're going to go into dorsiflexion first. Good. We're going to switch our hands, go into plantar flexion. Good. Overpressure. We go into inversion. Good. And then inversion. And we're testing for infield and available range and any reproduction of symptoms. Next test we're going to go through is anterior tibialis MMT. So I'm going to have you bring your foot up and in, dorsiflex and inversion. I'm going to have you do it one more time. Up and in. I'm going to pull out and down on you. I want you to resist my pressure, okay? 1, 2, 3, good. I'm going to grade that a 5. Next test we're going to go through is posterior tibialis MMT. So I'm going to have you point your toes down and in. Good. I'm going to have you do it one more time. Down, plantar flexion, inversion. I want you to hold. I'm going to pull you out and up. I want you to resist me, okay? Hold, 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 hold. Go and relax. I'm going to rate that a 5. If the patient is still in supine, we're going to go to fibularis longus MMT. So I'm going to have you point your toes down and out towards me. So plantar flexion and eversion. One more time for me. Down, out. Good. I want you to hold. Can you hold that for me? I'm going to stabilize at the distal tib, and then I'm going to push in. Can you hold, 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 hold? Good. Go on, relax. I'll rate that a 4. With the patient now in prone, we're going to go through the ankle plantar flexion MMT. So I'm going to have you point your toes down. Good. Back down. Can you hold there? I'm going to stabilize posteriorly, and I'm going to push down on the sole of your foot. Hold, 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 hold. Good. Go ahead and relax. This next test, we're going to assess the anterior talofibular integrity. We're going to do that using the anterior drawer test. So we're going to stabilize at the talus, at the mortise. We're going to, with the other hand, we're going to grab the calcaneus at about 10 degrees plantar flexion, and we're going to apply anterior force. We're looking for any reproduction of symptoms or excessive anterior movement. Next test we're going to go through is the Kleiger's test. We're going to assess a high ankle sprain and syndesmosis tear. So we're going to stabilize at the distal leg, and we're going to externally rotate the foot, and we're trying to reproduce any symptoms, opening up the mortise and prying open the tib and fib. With a patient in prone, we're going to do the medial talar tilt test. So we're going to stabilize at the talus and the mortise. The other hand, we're going to put the foot into 10 degrees of plantar flexion, grabbing the calcaneus, bringing the ankle into lateral flexion, trying to reproduce any symptoms in the deltoid ligament, or see if there's any laxity in the ligament at all. With your patient in supine, we're going to do the lateral talar tilt test. We're going to stabilize at the talus and the mortise. We're gonna grab the calcaneus and bring it into plantar flexion. We're gonna apply medial flexion. We're looking for any reproduction of symptoms or any laxity in the calcaneofibular ligament. This next test is done with a patient standing and holding onto something sturdy like the wall. Patient is going to be standing 10 centimeters away in a split stance. We're going to try and touch the knee to the wall, keeping the heel down. Go ahead and stop. If they cannot touch the wall, we're going to measure the distance from the knee to the wall, and we're going to compare it to the opposite side.